Hello, my name is Randy Taufik Kusuma, and I'm a student from Islamic Bandung majoring in information system. I made this video for the purpose of the fulfilling and the achievement of English language course. So, coronavirus or severe acquired respiratory syndrome coronavirus 2 is a virus that attacks the respiratory system. This is because of this viral infection that called COVID-19. Coronavirus can cause disturbance in the respiratory system of the pneumonia to death. The severe acquired respiratory syndrome coronavirus 2, known as the coronavirus, is the new type coronavirus. The severe acquired respiratory syndrome coronavirus 2, known as coronavirus, is new type the coronavirus that is contagious to human. The virus can attack anyone, wherever is a baby, a child, adult, senior, a pregnant woman, and a nursing mother. This viral infection is called COVID-19 and was first discovered in the city of Wuhan, China, at the end of December 2019. The virus is contagious rapidly and has spread to other regions in China to several countries, including Indonesia. This made some overseas countries enforce policies to impose lockdown to prevent the spread of coronavirus. Coronavirus is a collection of viruses that can infect the respiratory system. In many cases, this virus only cause main respiratory infections such as flu. However, this virus can also cause severe respiratory infection such as lung infection, pneumonia, middle respiratory syndrome, and self-accepted respiratory syndrome such. Coronavirus symptoms. Early symptoms of the coronavirus injection or COVID-19 can be a flu infection such as fever, cold, dry cold, sore throat, and heat class. After the symptoms can be remembered, the patient can get high fever, even bloody cold, softness to breathe, the chest and the chest pain. The symptoms are when the body reaches to coronavirus. However, there are generally common symptoms that can indicate that person infected with the coronavirus. Fever, body temperature above 38 degrees Celsius, cough, shortness of breath. According to certain symptoms of COVID-19 occurred within 2 days for 2 weeks after the exposure to the coronavirus. Based on the recent statistics as of 30 April 2020, there were at least two confirmed to be nearly 2 million people and who were recovered by nearly 5,000 people and who died due to COVID-19 in the world reached 118,000 inhabitants. In Indonesia, the COVID-19 case was confirmed as approximately 45,000 people and that was recovered by 380 people and 399 reported died due to COVID-19. Coronavirus prevention. Today there are no vaccines to prevent virus infection corona or COVID-19. Therefore, the best prevention way is avoid the factor that cause you to infection with this virus, namely apply physical distancing, which is to keep distance of at least 1 meter from other and not first out the house unless there is urgent need. Use masks as you move in public place or crowd. Routinely wash hands with water and soap or hand sanitizer containing alcohol at least 60% after outdoor activities or in public place. Improve endurance with a healthy lifestyle. Do not touch the eyes, mouth, and the nose before washing your hands. Avoid contact with sufferers or people suspected of suffering from COVID-19. Cover your mouth and nose with tissue when coughing or sneezing. They realize the issue of the trust, avoid exhaustion people who are sick of fever, cough or cold. Keep the hygiene of the objects that are the touched and the cleanliness of environment, including home hygiene. So, since we have to reduce the positive amount of the coronavirus, the government advises to use always stay at home, doing away with social distancing, so that the virus spread is smaller. What was something that can do the help when they're particularly like this? 1. You can clean the house. Yes, because you are at home and there is charm in order not to go out the house, then you can do clean new activity at home. Next to the clean house, cleaning the house can also burn fat in your body. Like a small sport is enough to replace your sport. 2. You can learn to cook. You, if at home, will continue to feel bored. Try you learn to cook. One value skill in cooking will develop test with the passage of time. The let alone social recommendation of keeping this long term. I will make it easy to you continues to learn to cook. 3. You can be quality time with your family. How long you want to be chatting with a family? Or how often the job are spent time with? If not, then it's currently suitable for those of you who want to feel quality time with your family, believing that your family relationship will be more and more humorous. 4. Do something new. Maybe you can and your game video are the best in one word top player in your online game. You can also watch video or movie that keep you entertained, read vlog and more. Of course, this is very enjoyable for you rather than getting out of the hospital, falling ill or to better home, doing something productive. 5. Work on school achievement. Work on school achievement in the head a student and the student how not. Trying to imagine, like one lecturer give one text composition of individual and text group. Multiply your attention amount. Text accumulate with deadline make a student a lot bigger in the middle as the panel. But it is very effective to make a spend time in the room doing text with fields, a book and paper, but hopefully lecture of the not often give enough material, only not with the text as well. Okay, I think here's 5 activities that you can do during the host. This pandemic host the amount of spread will decline when you adhere to government regulation, staying at home for your own health, so you are selfish to get out the forbidden inflation and disaster. Hopefully you feel